So I am Dr. Tomekia Luckett. I'm the Dean of Nursing here at Louisiana Christian University. I didn't initially start off wanting to be a nurse. Initially I wanted to be a cardiovascular surgeon, but the Lord, I believe He has a plan that guides each of us, and His plan is far better than anything we can imagine. So my boys, of course, are triplets. They were born at 23 weeks gestation, which is about 5.5, nearly 6 months, and it was a lot to have not only one child but three who were sick and in an NICU. And then I was a single mom. I realized through experiencing sickness with my children the wonderful job that nurses do and how passionate they were about what they were doing. They were 8 months old when I started RN school. You know, I had to study, I had to work my butt off, but it also made me focus because failure wasn't an option for me. Like, I didn't have a backup plan. I went around the world as far as with my education and with my experiences, receiving an associate degree and then going all the way up to a doctorate level, but I do think that God's hand was in it because I still became a doctor, just a different kind of doctor. I will say it is absolutely my calling, and not only that, it's my purpose, but it's also my passion. I fell in love with nursing and the patients, and that was the difference, what I could see as I became more involved, how hands-on the nurses were. Not that physicians aren't, but sometimes they have so many patients and so many things to do, they just don't get that one-on-one time with patients that nurses do, and that's the part of it I love. I love to feel like I'm making a difference, like I'm there to help somebody, which is a part of my purpose as not only a nurse educator, but as a nurse. And so from that, I transitioned into academia, and I've been in academia probably for about the last 14 years of my career, and it has been extremely rewarding because you get to see the students come in and they're wide-eyed and so bright-eyed when they first come in, and then they're terrified when you begin to tell them nursing stories, you know, tell them battle stories, and some of them kind of look like, is this really what I want to do? But then you get the calls later, I love it, and this is what I want to do for the rest of my life. You think about those students and how they grow and how they go on to do so many amazing things. And so just having that small hand in my students' lives, that is a purpose, and it's for sure a calling. So the world has changed, I think, as we all know, with the COVID-19 pandemic. And along with that, healthcare has changed. One of the things that the NCLEX individuals who write the examination that nurses have to take after finishing school, they discovered that nurses lack clinical judgment. And what the clinical judgment does, it prepares them better to prepare for those patients at the bedside. We can teach people a lot of things, but you've got to know in a split second, is this the difference between life, or is this the difference between a person losing a limb? There's so many decisions at stake, and so our ultimate goal here is to prepare our students to not only be safe, but to be competent. I always tell students, don't forget the person. In that bed lays a person. That's a person with emotions. That's a person with a family. That's a person who has needs and desires. And who knows what life may bring. One day you may be that person who's in that bed, and you want someone there to hold your hand and comfort you or your family member when you need it the most. So we have well-experienced educators here. We've been teaching for a number of years. And for us, it's not just a job, it's our calling. We are truly passionate about nursing education, which makes a difference in our classroom. We are not only preparing you to be a nurse, we're preparing you to be a Christian nurse. And in today's society, that's one of the things I think the world needs more of. Those who have compassion, those who can be empathetic, those who can be professional, those who can be courteous, and more importantly than that, those who can be competent.